Okay, well, it's the noon hour, so we'll begin our Social Security and Veterans webinar. My name is Jerry Hafer. I'm with the AMAC Foundation, a Social Security advisor with the AMAC Foundation. And joining me today are my colleagues, Eileen Cook, another Social Security advisor with AMAC Foundation, and Mark Hendelson, also a Social Security advisor with AMAC Foundation. And we're going to talk to you today about a couple of issues relevant to veterans and how veterans interact with Social Security. But first, I want to talk a little bit about the foundation, who the AMAC Foundation is. Our mission, very simply, you can read it on the screen, but we kind of summarize that by saying our mission is to support and educate America's seniors. The key part of our Social Security advisory service is key to the foundation mission, and that's where we handle questions about Social Security. Social Security is, going to put tongue in cheek and say it's a little complex, more so than most people realize until they get involved in it. And we handle roughly, I'd say 500, 600, 700 a month on average of people that come to us confused, desperate to try to understand how Social Security fits their personal situation. So we spend a lot of time with this. Our service is provided to the public free of charge. We are a 501c3 nonprofit, and we're part of the Association of Mature American Citizens organization. Later on, we'll give you some information about how to contact the foundation if you have specific questions about Social Security. Relative to veterans, just about 2 or 3 years ago, well, AMAC has always been active in the veteran community. In fact, 31% of the roughly 2 million members that are members of the AMAC organization are veterans. And beyond that, about 75% of all of the members of AMAC identify as having a veteran somewhere in their family structure. So supporting veterans has always been important to AMAC. And about 3 years ago, we expanded that involvement with the veteran community by creating something called the Foundation Veteran Outreach Program, FVOP. And the mission for FOP is described on the chart. But basically, what we're doing is we've created a mission whereby we interact with veterans organizations, with organizations that support veterans, and we're building alliances with those organizations. Every month we meet, we have a standard agenda, a standard schedule meeting where we meet with a collection of veteran support groups and just talk about issues affecting veterans and mutually exchange updates. And basically our mission is to help wherever we can support veterans. And that's growing. We have a growing network, and we're really pleased at the way that's growing. And so that's just a concentrated part of the foundation's mission called Foundation Veteran Outreach. And one of the things we decided it would be a good thing to do, because we get a lot of questions from veterans about Social Security. So we thought it'd be a good idea to put this webinar together and just talk about some of the fundamentals of how Social Security and veterans interact. So let's get into it a little bit. Some of the very basic questions we encounter deal with, well, exactly how do my earnings factor into Social Security? And so this slide basically talks about who is actually covered in Social Security as a veteran. And basically, if you're active duty military and you've had earnings, you've been covered since 1957. Inactive duty service in the armed forces has been covered since 1988. So basically, anyone serving in the military before 1957 is also given special credit for their service. We'll talk about that special credit issue in just a few minutes. But a very common question we get at the advisory service is, how do I make sure I receive the extra $300 a month in my Social Security benefit from serving in the military? That's a question that, as I said, we encountered that very frequently, because there is a perception that being a veteran will get you an extra $300 a month on the bottom line in your Social Security check. And I want to talk a little bit about that in the next couple of slides, just to clear that up. So let's talk about how that works. When you are in the military, you pay both Social Security and Medicare taxes. So let's talk a little bit about how Social Security benefits are calculated. This is important to understand as we talk about the extra credit. Your Social Security benefit is based on your highest 35 years of earnings. The way Social Security calculates your basic benefit is they will take the highest 35 years of your earnings records through age 59, and they'll index those years for inflation, meaning present value them, bring them up to what they would be worth today. And they're then added together and divided by 420, which is the number of months in 35 years. And that produces something called the average monthly earnings, average index monthly earnings. I got to make sure I get the terminology correct. And that's the basis for determining what your benefit is going to be. Anyone who served in the military after 1956 paid Social Security taxes on these earnings. I'll say something in a moment about before 1956. But under special circumstances, there are credits that are applied to your earnings record so that you get additional credit for that time that you worked. And we're going to talk a little bit about that next. So if you were on active duty from 1957 through 1967, Social Security added extra earnings to your record. Remember when I said your earnings records basically is your earnings that are averaged to calculate your Social Security benefit. So from 1957 to 67, Social Security will add an extra earnings amount to that record. And we'll talk about that in a moment too. From 1968 to 2001, you didn't need to do anything. That happened automatically. Actually, it happened automatically from 57 to 67 as well. But you don't really need to do anything for that. After 2001, the extra special earnings credits stopped. That was only through 2001. So that's just a quick look at the time frames involved. From 1957 through 1977, you were actually credited $300. Credited here means that's an amount that was added to your earnings record upon which your Social Security benefit is actually calculated. From 78 through 2001, for every $300 in active duty basic pay, you were credited with an additional $100 in earnings up to a maximum of $1,200 a year. And again, these credits were actually added to your earnings record, not to your Social Security benefit. So it's important that you understand that difference. And if you were enlisted after September 7th, 1980, you didn't complete at least 24 months of active duty on your full tour, you may not be able to receive the additional benefits. That's a specific detail that if that applies to you, you should check with Social Security for how it applies to you. So that's how the dollars are determined for extra earnings credit. I mentioned earlier about the earnings began to be applied from 1957 on. If you served in the military from 1940 through 1956, you were awarded special credit. That special credit actually is $160 a month that was added to your Social Security work record for each month you served in, if honorably discharged or released due to disability or injury in the line of duty. So that's how the period of military duty from 1940 to 1956 was handled. In all cases, the additional earnings are credited to your earnings that have been averaged out during your monthly lifetime, your working lifetime. They're not added directly to your monthly benefit. And so that's where the misunderstanding comes into play. So the answer to the question that we frequently get, unfortunately, is no, your monthly Social Security benefit is not increased by $300 per month due to these extra earnings. The extra earnings go into the calculation process that typically produce a higher Social Security benefit, but they're not added to the bottom line of your benefit amount. So that's a distinction that we make with people that raise the question with us. Now, another thing that we wanted to cover in this webinar is the retirement earnings test. That's something that is something that affects a lot of people that begin to draw benefits, Social Security retirement benefits, prior to their full retirement age. Full retirement age is anywhere from 65 to 67, depending on the year you were born. But for people that begin to draw their Social Security benefit, there is a earnings test that is applied that basically has the potential of reducing, temporarily reducing your Social Security benefit. I'd like to ask Mark to talk more about this. Mark is a seasoned Social Security Administration veteran of a different sorts, but he has been in the trenches dealing with the public on Social Security and has fielded this question fielded this discussion on retirement earnings test many times. I'm sure it's probably one of his favorite discussion topics. So Mark, why don't you take over?
Thank you, Jerry. The most important concept, in my humble estimation, for everybody who's considering filing for Social Security, who's on Social Security and not yet reached full retirement age, to me, the most important concept, if you're employed or considering employment, for you to understand is how the Social Security retirement earnings test works, along with the monthly earnings test. That concept is important to understand, because if you are working and you don't understand clearly the rules regarding what you're allowed to make and how your earnings may impact your Social Security benefits, you may cause an overpayment. The largest cause of overpayments within the Social Security system is related to people who are working and earning over the allowable amount under the Social Security earnings test, and they don't report those earnings timely to Social Security, causing them to get paid for months they're not due benefits. So let's look through some of the slides. Really critical that we understand this concept. So the Social Security annual earnings test, in simple terms, means that if you are filing for your benefits prior to the month you attain full retirement age, and we'll call that FRA, prior to the month you attain FRA, Social Security puts a cap or a limit as to what you could make in the way of earnings without those earnings impacting your Social Security benefits. That cap, that limit under the annual and monthly earnings test, that does change annually. It's set by Congress. Usually we learn those numbers for the following year sometime in October, based on the National Average Wage Index. If you are getting Social Security benefits and your earnings cause your benefits to be suspended, once you attain FRA, that reduction percentage that is impacting your benefits because you filed prior to FRA, that will be adjusted. It's called an R, for an adjustment of the reduction factor. So you do lose the benefits temporarily. But if once you attain FRA, your benefit percentage, that reduction, will be adjusted to give you credit for the months that you didn't get benefits. And over time, that higher benefit amount, you will recoup the benefits lost. And I'm gonna reach for my connection here. I'm sorry, I'm having some connectivity issues, so bear with me for 1 minute. Thank you for that. So, as I mentioned, you do lose benefits if you earn over the annual or monthly earnings test provisions of the law. But once you attain your FRA, your benefits will be adjusted to give you credit for the months you didn't get payments. And those benefits at the higher rate will eventually make up for the benefits you lost due to being in work suspense. Next slide, Jerry, please. What counts and doesn't count as earnings is really, really important to understand. Okay. What is going to count towards that annual and monthly earnings test limits? Simply put, it's your gross wages before deductions. It's your net earnings from self-employment, contributions you make to a pension or retirement plan, if that contribution is included in your gross wages. And lastly, we get this question often, VA benefits, veteran benefits do not impact the annual or monthly earnings test provisions. So it's gross wages and net earnings from self-employment. Those are the key numbers, the key amounts, the key income that Social Security looks at when determining whether an individual has gone over the published annual limit of earnings or monthly earning limitation. Jerry? Let's do a little math. Let's go over the limits for 2024 and how exceeding the annual and monthly earnings limits impacts your benefits. In 2024, if you have not yet reached the age, excuse me, if you've not yet reached the year that you attain full retirement age, that limit or cap is $22,230 in gross wages and net self-employment, or $1,860 a month. If you exceed the limit, for every $2 you go over the limit, you lose $1 in your benefits. So if you've not yet reached the year where you attain your FRA, full retirement age, that's your cap, $22,230 annually, $1,860 monthly. That's gross wages, net self-employment. If you go over those amounts, half of the money you make over that limit will be held up in your Social Security benefits. The year you attain FRA, the rules change. You're allowed to make up to $59,520 for the months prior to attainment of FRA. Remember what I mentioned earlier, once you attain FRA, there is no earnings limitation at all. So if you attain FRA in August, the only months of earnings of Social Security will count are what you make January through July of that year. And it's a much larger amount. It's $59,520. And if you exceed that amount, Social Security will hold up not $1 for every $2 over the limit, but $1 for every $3 over the limit. So the earnings amount and the penalty or loss of benefits amount are much more liberal the year you attain your full retirement age. And the limits you see on the screen in 2025 will be going up for sure. We should know about those amounts within the next couple of months. Next screen, Jay. I mentioned earlier the monthly earnings test. You have one opportunity, usually it's your first year of entitlement. You have one opportunity to use what Social Security calls a monthly earnings test. I like to call it teacher's test. Most educators retire middle of the year, June, July, August, maybe having earned anywhere from $30,000 to $35,000, $40,000. Well, it's not fair to negatively impact that individual if they're ready to start getting their benefits because they've gone over the limit for the year for those 5 or 6 or 7 months of employment. So what the monthly earnings test does is it says you could make an unlimited amount of money up until you retire. You can make $1 million from January to June. Beginning in July, if you stop working completely or if you cut your earnings back to the monthly level, which is the annual level divided by 12, you cut it back to the monthly level, you are due payments. So you can make as much as you want prior to retirement, effective with the month that we start paying you your benefits. As long as you keep your monthly earnings under that monthly level, you're due benefits the rest of the year, even though you exceeded the annual limit. So that monthly level helps individuals who retire middle or latter part of the year who've exceeded the annual level to start getting their benefits because their earnings have dropped to either zero or under the monthly level. But a key caveat with this monthly earnings test rule is if you go over the monthly limitation by $1, you lose that benefit check for that entire month. There's no proration. It's not $1 for 2 or $1 for 3 like the annual test I mentioned earlier. So again, monthly earnings test is really important to understand. You retire middle or latter part of the year, you make way over the annual limit, you can start benefits effective with the month you ceased work and get benefits for the balance of those months in the year, as long as if you do work, you keep your earnings under the monthly level. That's called the monthly earnings test. If you don't use it during that first year of entitlement, you do have the ability to apply that the following year. And that happens often. People retire, start getting their benefits, and then a job opportunity is presented to them for the following year. They might have gotten 6 months of benefits that second year. They go back to work making a lot of money. Well, they're due those benefits that they received for the first 6 months of the year, even though they may go over the annual level for the last 6 months of the year. Jerry? Self-employed people have special rules. Special rules. There's an hourly rule for self-employed, okay? The development involved in this, I can tell you firsthand, is very complex and very tedious. So I'm just going to keep the conversation very basic and general, okay? Not only is there going to be the annual cap, Social Security is going to look at how many hours a month you spend involved in the business. The cap is 45 hours a month. But, and this is where it becomes quite subjective, if you're in a highly skilled occupation, they're going to look at the cap of 15 hours per month. So if you're self-employed, you're continuing to work in self-employment, it's very important you go on the Social Security website and educate yourself about self-employment and the annual earnings test and the monthly earnings test. Jerry? How does an individual's work impact dependents? So if you have a spouse and maybe eligible minor children on your record, if you are the worker and you're not getting paid because of you going over the annual or the monthly limit, unfortunately, that means your dependents' benefits will be put into work suspense during the same period you don't receive benefits. So your benefits are withheld due to work or excess earnings. Anybody else eligible on your record, spouse, minor children, disabled children, children in high school, anybody eligible on your record, their benefits will also be suspended. But if you have a spouse on the record and he or she goes back to work earning over the allowable amount, their work over the annual or monthly earnings test rules does not impact the worker. So the dependent, the spouse, they would be put in work suspense, while the worker would be eligible to continue to get his or her benefits. And then lastly, on that slide, it talks about dependent benefits. There's a family max. So we pay the worker first, and then there's an amount left over that goes up to a family max. And depending on how many individuals there are eligible on a record, we would take that family max divided by the number of eligible individuals, and they each would get an equal share of benefits on the worker's record. So that's the concept is called family maximums. We pay a maximum on a record. First, we pay the worker, and then depending on how many dependents are on the record, the family max may come into play, and benefits would get divided up equally among anybody else eligible for benefits. Jerry?
Before we leave this topic, I just want to make a comment. AMAC is actually working on a proposal to Congress to basically improve Social Security and try to avoid the insolvency that's you read about in the news. And one of the recommendations we're going to make is to eliminate the Social Security earnings test because it's a horribly complex situation for people to track. There's a lot of record keeping involved. It's the source of a lot of the overpayment problems that Social Security is dealing with. And we feel that it should be eliminated. We're going to recommend that. And also, part of our recommendation deals with the fact that it's a disincentive for people to work. And so, people just avoid it by not working at all. And so that's not really good for anybody. So I just wanted to call that a corporate advertisement, if you will, for Social Security reform. Want to touch briefly now on veterans and Social Security disability insurance, another topic that comes up frequently. And the point is that the qualifications for SSDI, Social Security Disability Insurance, are different from the qualifications for veterans disability. And we just wanted to touch on this so that you get a feel for what those differences are. Social Security pays, by definition, Social Security pays disability benefits to people who can't work because they have a medical condition lasting at least 12 months or that are projected to end in death. The VA, on the other hand, pays disability compensation to veterans who have a service-connected disability that was incurred during or was aggravated by active military service. So a little bit of a difference in definition on the qualifications for disability. If you have a VA disability compensation rating of 100% permanent and total, then you need to make sure you inform Social Security when you apply for SSDI so that you can receive expedited processing. There is a provision for people that fall into that category to receive their determinations on an expedited basis. So it's important that you call that to their attention. If you develop a disability while you're on active military service on or after October 1st, 2001, and that provision is categorized as disability benefits for wounded warriors, you may be eligible for expedited processing under that situation as well. Basically, in many cases, you will need to provide, actually, I guess in all cases, you will need to provide your DD-214 document in support of your application. So keep that handy when you get into this area. This chart basically summarizes the differences between the two. It's a good reference chart for you. It's available directly from the Social Security site, ssa.gov, and the URL for getting a copy of that if you want to print it for your records is shown at the bottom of the slide. But basically, is a compilation of which provisions apply to VA and SSDI. So it's kind of helpful when you get into this area to make the determination of what applies to you. There are some income restrictions. Oops. Excuse me. There are income restrictions for receiving VA disability benefits. I'm sorry, there are no income restrictions for receiving VA disability benefits. And that's not really the case on SSDI. We'll talk about that in a minute. VA disability benefits are available to any veteran that the VA has determined has a service-related condition that affects their health. On SSDI, though, the income restrictions are governed by something called substantial gainful activity limit. That means you cannot, well, on SSDI, you cannot earn more than $1,550 per month. That's the 2024 limit. And like all the other limits that we've talked about so far, that changes every year based on the National Average Wage Index. And there's no annual limit. That's a distinction. This is a monthly earnings limit, and it's not an annual limit. It's just determined monthly. In terms of applying, how do you apply for veterans or SSDI? They are separate agencies. SSA and VA, of course, are separate agencies. They run their programs independently. So you must separately apply for each program, but you can do it at the same time. To apply for the Veterans Benefits Online, you can use VA Form 21-526EZ, which you can download from the va.gov website, and the URL is shown, va.gov/VA forms. For SSDI Online, you can apply online, or you can apply by phone, or you can apply in person at a local Social Security office. And if you need to find your local Social Security office, there is a SSA office locator that you can access on the va.gov website. Just key in office locator, and it'll ask you for a location and give you the nearest office. So basically, those are the ways that you apply for both VA and SSDI disability. I want to get into just a little bit on veterans and Medicare, another area that we encounter frequently. Veterans will contact us and say, I have VA healthcare benefits, why do I need Medicare? And it's not as simple, you do or you don't. So we want to talk a little bit about that, about why it's important to really think this through. So I'm going to ask Mark to step back in on that.
Thank you, Jerry. So veterans and Medicare Part B. Let me start up front by differentiating between veterans insurance, veterans who are getting insurance and services through the VA, and also military retirees who have TRICARE for life. The rules are distinctly different for each of those two individuals. If you have TRICARE for life and you're turning 65, you are required by the TRICARE program to file for Medicare. That makes Medicare primary. TRICARE for life would be secondary. If you are a veteran and you're using the veteran services, filing at 65 for Medicare is not a requirement, but it is definitely recommended. Very few people in all my years of working with Social Security, very few people when they turn 65, especially veterans who may have health issues, health needs, very few opt to pass on Medicare at 65. Medicare is important because if you need coverage and you not able to go or don't have access to a VA facility medical professional, you're able to go to a non-VA hospital or doctor. You have many more options to choose from. The other reason it's important is you have that VA, you may have that VA coverage now, but there's no guarantees about coverage in the future or what your needs are going to be as you age moving forward. That's why having that dual coverage, having the Medicare as primary, VA as secondary, is critically important. If you opt not to sign up for Medicare Part B, if you opt not to sign up for Medicare Part B, That's the doctors and outpatient services, and you opt to sign up for it later on, there will be a penalty. It's a 10% penalty for every 12 months you delay past the age of 65 and signing up for Medicare. So if you're age 70, your health needs have increased, VA services are not meeting your needs, you say, you know what, I made a mistake. I opted not to take Medicare Part B at 65. You certainly can sign up for it at 70, but understand you will pay a penalty of approximately 50% more for the rest of your life for your Medicare Part B coverage. So if Medicare Part B premiums are $200 when you turn 70, you'll pay $300 a month for the rest of your life for that coverage. So when deciding whether to take Medicare Part B, keep in mind, if you opt not to take it, there will very possibly be a penalty if you delay enrollment by more than 12 months. It's 10% every 12 months you delay signing up for it. Same thing with Medicare Part D, the prescription drugs. Again, that's extra coverage on top of what you may have in the way of VA coverage. Instead of using the VA mail order service, that might offer you better options from a coverage standpoint by taking the Medicare Part D. So there's Medicare B, the doctors and outpatients, Medicare D, the drug plan. A is the Medicare part for hospital coverage, no charge. So if you opt not to take B and D, you certainly would want to sign up for Part A when you're turning 65. Jerry? That's what I was mentioning earlier. Whether or not to take Medicare Part B, in addition to your VA medical coverage, it's a very important decision to make. We again recommend that you do take that coverage. There's lots of great information on the VA and the Social Security websites. You can see those links on the slide. If you are getting Social Security benefits at 65, you've taken benefits early. That could be spousal benefits, widow's benefits, that could be retirement benefits. You will automatically be enrolled in Medicare A along with B when you turn 65. If you opt not to take B, you could opt out and disenroll. Medicare Part A and B covers 80% of all your medical expenses if you were treated outside of the VA system. So you might want to consider, in addition to the VA coverage, you might want to consider a supplement or what they call a Medigap policy to cover those gaps in the Part A and B coverage under Medicare. Jerry?
Okay. Covered quite a bit of material in a short period of time, and you may have some questions relative to your specific situation. Most of Social Security is situational, depends on your individual circumstances. So I would encourage you, if you have any questions or if you need any support in trying to make a decision on any of these issues, contact our Social Security Advisory Service. And the telephone number and email address are displayed there on the chart. And also, I would note that we maintain a separate website called the socialsecurity.report.org. The URL is shown there, and medicarereport.org. And a lot of these topics are covered frequently on those two websites. For example, I know on the socialsecurity.report.org, we have published many articles about the earnings credits, about the question of, I'm a veteran, do I need Medicare if I have VA coverage and that. All you need to do is go to that website and in the search bar put in veteran, and you'll get a listing of all the articles that have been published about that. And they go into a lot more detail than we've gone into in this brief webinar, but I would encourage you to visit those sites. And also to visit the amacfoundation.org website and check out our events page periodically for upcoming seminars. And that's about it. I want to thank Mark and Eileen, and all of you that attended this. Hope that you received some valuable information. And again, feel free to contact our advisory service with any questions at all about your situation and Social Security. So thank you very much.